only student on rounds and an attending asks a question that's pharmacy related. What are you going to say?
I don't think they can hear you.
You're right. So my mic was off and I was talking when you guys weren't listening. I'm sorry. Thank you to whoever figured that out the fastest. Good job. So I was standing up here talking to Athens and no one was answering me, but obviously it's because my mic got turned off. Sorry. So what I was saying, we're going to start with Athens with rituximab. And I would like a brave soul to tell us what they found about rituximab, and then we'll fill in the gaps from there. Kind of thinking that, this is practice for when you're on rotation. If you're on rotation and you're rounding or you're in the clinic and an attending physician asks you a question related to a drug, what are you going to tell them? These are real scenarios that are going to come up, and I want you to be prepared and be confident. So, what can you tell us about rituximab that you would tell a patient?
It's an IV medication.
Okay, good. So you want to tell them how they're going to be receiving it. So it's an IV medication. What else do you want to tell them?
It could cause them to be tired or weak and have nausea and diarrhea.
Okay, so you want to tell them what some common side effects are. What other side effects did you guys see that would be important to tell a patient?
You could mention that they may experience some fever and chills, and if it happens, you can take Tylenol. But if it happens like a couple of days after receiving the rituximab, you would want to tell your doctor immediately because it could be a sign of an infection.
Good, so you want them to know they can have infusion reactions and what the signs and symptoms are of those, and then delineating that from later fevers where it could be a different problem. So that was good, making sure they know what to do at the different time points. What else? Remember your standard, what is it for, what does it do, what to expect. So we got a little bit of the what to expect, but what about the other counseling points? The what does it do and what is it for is a little harder because I know you guys haven't had practical therapy, but when you look up the drug information, it tells you a category of drug, right? So this medication is an IV medication. It's called a monoclonal antibody, and it targets the specific cancer cells in your body, right? So knowing that it's a monoclonal targeted therapy will be helpful for a patient to understand what they're receiving. Any other things that you all found before I put up the long list? Points you want to tell somebody?
If they experience a severe rash or any mental changes, they should go to the hospital to be checked.
Okay, good. So delineating kind of common side effects from severe side effects is important. So looking back to that list of things you want to tell people, what is it for? How will they be receiving it? What should they expect, common and severe, what to do about it? And any monitoring that might be needed before or after therapy. I think we might have missed that one a little bit. Did anyone see what you have to monitor at all? So it's a targeted therapy, so if you were dispensing this, you want to make sure the patient actually has the target in question, right? So the patient doesn't need to know that, but I'm telling you because it relates to what we talked about earlier in this lecture. So you do not need to write all this stuff down. I'm going to post these slides as well. So don't panic and try to, flurry catch all this, because I will post this after the fact. So you want to tell someone what does it do and what is it for. So this is a medication given through the veins. You guys, picked out that it needs to be told what route the patient's going to receive it. And then there are various different frequencies and number of cycles. So you've got to look at their chemo order to know that. But depending on the indication, that can be different. So every 3 weeks for 4 cycles or something like that. You tell them that it targets the cancer cells that express a certain marker and causes them to be killed off by the body. So they understand how the drug is going to work. Serious side effects out of the product labeling are going to tell you the infusion reactions, which you guys aptly picked out. But also hepatitis B reactivation is a problem, so you want to make sure that the physician had screened for hepatitis B first. And you'd counsel the patient about infusion reactions, as you said, so fevers, chills, things like that. And then to report any problems that could be related to hepatotoxicity, like abdominal symptoms, jaundice, etc., in case they had a hepatitis issue. So that would be a counseling point. And then in the product labeling, you probably saw there were some severe but rare complications like mucocutaneous reactions and PML. So I don't usually, for those very rare but severe side effects, go in depth to patients. That's not my practice style. But I will have them be aware of the major side effects. So someone mentioned rash, so that's important for the mucocutaneous kind of reactions. They can have rash and mucosal problems. And then neurologic changes for the PML, so if they feel confused or like they're acting differently, to make sure they reach out to the physician immediately. So I kind of just give them the gist of what they would look for, but you don't necessarily have to give those terms to the patient because they're not going to know what that means anyway. And then common side effects, someone mentioned risk of infection, so if they have fevers, to contact their doctor, that was good. And then come to the ER again if they have the fevers, neurologic changes, and then any uncontrolled symptoms, kind of always a normal one you can say. And then you always want to ask what questions they have in an open-ended manner so that they feel very comfortable saying if they didn't understand something or they need clarification. So again, I'm going to post this, but hopefully that was a little bit helpful in how you kind of go through a lot of information and narrow it down to what you tell a patient. But what is it for, how do they take it, what to expect, kind of group it like that like you always do, makes it a little easier to digest. All right, so Albany and Savannah, you guys had dasatinib. This is an oral chemotherapy, so either group can kind of start chiming in with what you had, what you would tell patients for this medication.
It's an oral medication for leukemia that needs to be taken at the same time every day.
Good, so what it's for and how we take it, that checks some of those boxes. What else? I heard somebody else chime in.
If you're of childbearing age, you should use birth control, and if you're pregnant, don't handle the medication.
Okay, good. So some safe handling, because this is a medicine that's taken every day in a community setting, so they need to know what to do with a medication like that. It's hazardous. Good.
Monitor for signs of bleeding because it can increase your bleeding risk, so look for bruises that won't go away and things like that. Also teach them to monitor for signs of hypokalemia, such as confusion and muscle pain, and it can also cause fluid retention, so you would monitor your weight and any signs of swelling and report that to a healthcare practitioner if needed.
Good. So a lot of side effect points and some kind of what to report to the physician. Anybody have other side effect or counseling points they want to throw out there?
Report any signs of infection or any severe symptoms such as nausea, vomiting, severe diarrhea, severe abdominal pain, and any significant reaction like wheezing, chest tightness, fever, itching, bad cough, blue skin to their provider.
Okay. So some of those might have come off of like the things to tell your patient list that I don't always say all of them. My style is to look at the percent of adverse reactions, and if they're not severe reactions and they're less than 20 to 30%, I don't always tell them all of that. So I try to pick the ones that are the most common and frequent. And then just, as we said, mention the severe yet rare, making sure we tell patients they're rare but severe. Because a lot of times the list, sometimes it'll be like the counseling points listed somewhere, they're just a laundry list of things that may or may not percent-wise happen frequent enough to tell patients. So that's just my style, just to give you an example. So for dasatinib, you know, if someone said they take it once a day at the same time, it would be important for an oral chemotherapy to delineate whether they take it with or without food, whether they can split it or not, which now we know you can't. This particular drug has interactions with all acid suppressives, so you want to screen someone's profile to make sure they're not on something, so you can counsel them about taking those apart if necessary so that they absorb the drug accurately. There are some other drug interactions that are specific to this drug. You might see grapefruit juice and St. John's wort, so those are common things. We put labels on the bottles to make sure patients avoid. And then what to do about missed doses for oral doses in the community setting. You want to make sure they know not to double up and unsafe practices like that. You'd want to tell them, you know, adherence is very important with oral chemotherapy. So you'd want to stress that in your counseling point. Storage of oral chemotherapy at home so that they keep it in a cool, dry place away from pets and children and all of that. And then you guys mentioned a lot of the key, most important side effects. So lowered blood count, so signs of bleeding and infection, you guys mentioned, that was good. Fluid retention and all the symptoms of that, you guys hit that point, which was good. The nausea and diarrhea, you also hit. And then a key one for this drug is pleural effusion. It's one of those rare but very important things that patients don't necessarily notice signs and symptoms till they have it, but I wanted you to be aware of it clinically speaking. And then you mentioned, you know, going to the emergency room, I think, for fevers and markers that will need to be monitored are the blood count, electrolytes, and the actual target that this drug hits for their disease. So patients would have to come back for monitoring of those things in the clinic setting. And then again, you're open-ended what questions can I ask. So you guys hit a lot of these. Just remember with oral chemotherapy, drug interactions, and all the specifics of how to take it, you know, away from their other medicines or same time each day or with or without food, make sure you always have those little points in there as well so that they take it accurately. And again, I'm going to post this so don't feel like you have to write it down. Alright, Augusta, you guys had the IV chemotherapy regimen for breast cancer, which is doxorubicin and cyclophosphamide, the AC regimen. So can someone kind of give us the key pieces of information you guys pulled out for this?
Make their like sweat, tears, and stuff red. It can make their sweat and tears and secretions red.
Okay, so something definitely patients are going to notice. So if there's anything like that, they need to know to not be alarmed about. That's good to tell them. What else?
It's a combination regimen, so they should know that they're getting 2 different chemotherapy drugs, but at the same time.
Good, so they need to know they're getting more than one agent and what they're kind of collectively doing and what individual side effects are. What else?
It's every 2 to 3 weeks for 4 doses.
Good, so they need to know they're receiving this, you know, every couple of weeks for several different cycles, so it's not a one and done. And a lot of new chemotherapy patients think they come in, they get the chemo, they're done. Sometimes a bit of a shock to realize they're going to have to come back multiple times, and that's not how that works. What else?
Let them know that after 10, 14 days, you can possibly lose your hair on your head and body. Just expect that and not be surprised.
Yeah, so alopecia is a very distressing side effect for patients, so making sure they know when to expect it and that their hair will grow back eventually can help kind of ease them into that. What other side effects did y'all see?
Cardio one.
So cardiotoxicity, so they need to be aware that there's a risk of cardiac dysfunction in the future.
Make sure to stay plenty hydrated with cyclophosphamide.
Good, maintain hydration because cyclophosphamide can damage the bladder and cause those side effects. What else?
Look out for like blood in the urine.
Look for blood in the urine, so maintain hydration but report any blood in the urine. Yeah, so blood on the stool, dark tarry stools, any other sign and symptom of bleeding from either the anemia or thrombocytopenia.
They have like a fever, or like a cough or something that isn't going away on its own. They need
Yeah,
to let their doctor know.
report fevers and any signs or symptoms of an infection like a cough or anything.
severe nausea.
Can cause nausea and vomiting, so you wanna make sure they know that they've got medicine in case that happens and it's all under control.
They shouldn't get any live vaccinations while they're on it.
So vaccinations is a good point. I'm totally gonna table that for our discussion here, because it's kind of, there are a lot of different recommendations depending on what type of chemo we're talking about and what schedule, so. In general, no, people on chemotherapy don't get vaccinations, but I don't wanna say that as a blanket, because that's not always true. Live vaccinations, that's correct, but, I don't know. I don't wanna open that can of worms. What else? So mouth sores or mucositis can happen. So a lot of what we're talking about are side effects, right? So there's some common side effects and some severe side effects to report and come to the ER for. And we talked about how they're gonna get it, how is it gonna work, and what is it for, right? Nobody said that yet. So you wanna make sure you tell them this is, cytotoxic chemotherapy that's gonna kill off rapidly dividing cells. So therefore, this is what's gonna happen. The cancer cells are gonna die, but you have a lot of other cells in your body that are damaged. That's why you get alopecia. That's why you get mouth sores. That's why you get low blood counts that can lead to fevers and bleeding. Kind of tying it together. People are smarter than we give them credit for. So if you tie things together for them and kind of break it down to a very logical step-by-step, they're gonna understand. If you just give them a list of side effects, some people are gonna be like, well, I don't wanna do that. Why would I do that if it's gonna cause all these problems? But if you tell them, here's what it's doing, but it's also gonna cause this other complication that we can manage, they're much more amenable to saying, oh, okay, I will take that benefit and this little bit of risk as well. It's all about how you frame it. If you just give them a list of side effects, but don't tell them the benefit, that's gonna psychologically set them up to not really wanna be compliant, right? Or to be very concerned and worried about things. So overall, you wanna tell them they're receiving two drugs. These go through the vein. So you wanna tell them what they're getting, that they cause cancer cells to die off, but they're also gonna have other side effects from the other cells that are affected. So you guys accurately identified alopecia, nausea, vomiting, and myelosuppression as the main side effects. There are some counseling points about each of those that you guys already mentioned that I've listed here. We talked about other side effects that are common with cytotoxic chemotherapy, so diarrhea, lower appetite. We mentioned the blood in the urine from the cyclophosphamide, the heart problems from the doxorubicin, and then the symptoms they should report to their doctor. Because AC is for breast cancer, which is mainly affecting women, you would want to talk about infertility being a potential side effect, and then if they're planning to get pregnant or breastfeeding, they need to talk to their doctor first, because these are damaging in those types of patients. And that patients will have to come back for blood count monitoring in future cycles. So that's kind of what to expect moving forward piece as well. So every regimen has its own things to monitor, what to expect, what the severe side effects are. But I just wanted to give you guys a little bit of examples of looking this stuff up and kind of framing it, just like you do every other counseling. People get overwhelmed by oncology, but it's the same thing you already learned, just applying it in a slightly different way. So just remember your basic principles and apply them here, and you'll do very well. So don't feel overwhelmed. It's totally doable. So we are done with the in-class stuff, but on ELC there should be assessment quiz that's open until 5 p.m. Should be open until 5 p.m. That's what I set it for. You guys should take this individually, please. There are calculations in there, so make sure you have your calculator out when you're doing this. This is very similar to what the exam is going to look like. So if you have a hard time with this, email me, come see me. I'm happy to help you. It's mostly calculations like we did in class. There are a few kind of content related to the safe handling and whatnot that we did as well, so I try to emphasize those points. But if you have any questions, please reach out to me. I'm happy to help. But we'll go ahead and complete that quiz independently in ELC to get the points today. Any questions from the other campuses here in Augusta?
Yes, Dr. Clemens. A few of us, like I usually at work at 4 and it's 20 minutes away, and normally we have about a week for the quiz. Is it possible to get that extended past today?
Yes, I can go in and change it to 5 p.m. tomorrow. It's not a very long quiz, so it shouldn't take too long. All right, any other questions? Excellent, thank you guys.